So the good news is that for 17-18, which starts in April, we have more money than we had last year. The bad news is that that money is not enough to cover all of the things that we need to provide for our local patients and residents. So you'll be aware that the cost of providing care to people who are getting iller and the cost of providing new products and technology means that the amount we have isn't enough to cover everything that we need to. That doesn't mean we won't be doing anything. We've got lots of initiatives planned to try and make sure that the CCG and the whole health economy can live within its means. Our job is very much to make sure that we get the best value for the Berkshire West or Wokingham pound. This means that the allocation we get from the Treasury, we're putting that to the very best possible use to deliver the highest value for money for the taxpayer and for the local people who use our services. You'll now see some more information from colleagues who will be able to explain in more detail some of the plans which we're working on for development and deployment this year.
What we're trying to do is get the patients to see the right person at the right time, and that may be a doctor, and I'm not saying that we are not going to have doctors in the new healthcare system in Wokingham, but quite often there are people better placed to look after you. We have an increasing number of patients in the area, and the demand for appointments is growing on an exponential scale over the past few years. Trying to deliver good health care for these patients at a timely manner with the right people is the biggest challenge the CCG is working on right now. We are looking at extending practices, we are looking at improving buildings, we are looking at increasing capacity in buildings. Secondly, we are looking at expanding the workforce model. Historically, you had a problem, you went to see the doctor. Over the past few years, you may go to see a nurse or a doctor, and we're looking at increasing that range of team quite dramatically. We're introducing a wider range of healthcare assistants which provide a lot of the more junior nursing and admin roles for the patient. We are expanding our primary care team of nurses to include nurses who are looking mainly at acute care, i.e. illness on the day. The other three ones that we're working on particularly in Wokingham are pharmacists in practices, which some practices already have. We're trying to roll this out over the whole footprint of the Wokingham CCG. The practices have just been successful in applying for money to provide this, and we would hope to have a part of a pharmacist in every practice by this time next year. This will take some of the workload off of the doctors who, rather than seeing them about a medication problem or a medication review, you may be seen by a pharmacist. The first physicians associates, who are a new breed of health professionals who are looking at working underneath the GPs together with our big team of nurses, are beginning to roll out of Reading University, and we see these fitting in to chronic disease care as well as acute on-the-day care. And thirdly, I think we're looking at whether we can use other sectors of healthcare workers, such as paramedics for emergency visiting, mental health workers going forward, to try and bring that element closer to home for the patients. We're working on is a team called the Community Navigators, which are a signposting service to all patients to allow them to access voluntary or specialist groups to help them with any disease or any issue of living that they have. I think the patients will hopefully get a more timely appointment with the most appropriate healthcare professional to sort out their medical needs.
Mental ill health can be extremely distressing to go through. It can rip lives apart, really, when it hits severely, and it's a real challenge to make sure that the right sort of support is available for people at the right time. What we've looked at is actually making sure that service is available for people where they need it and when they need it. So one example of this is Street Triage, which is a mental health specialist working with the Thames Valley Police and with the South Central Ambulance Service to deliver mental health expertise at the point of a mental health crisis. Already shown in the year of the pilot Been a huge reduction in the number of people who formerly had to be detained in police custody for their own safety and for the safety of others because of a mental health crisis. Now those people are looked after either in their own home, they're connected to the crisis and home treatment team, or they're taken to A&E, where there's a dedicated mental health professional team called the Psychological Medicine Service, based at the Royal Berks A&E, able to deliver mental health expertise, again, at a point of crisis. So we're aiming to change the way we deliver mental health services in order to make sure that we're delivering the best possible support, and as early as possible. So rather than waiting for people to get to crisis, making sure we can deliver early intervention and prevention, including early access to psychological therapy that we know helps, if you like, side effect free compared to medication, but often in addition to medication where needed, to make sure people have long-term support and to be able to help themselves. There's been a huge rise in childhood and children and young people suffering mental ill health and behavioural challenges. The previous child and adolescent mental health service had struggled with waiting times. Now there's been real investment and prioritisation to get those waiting times down. Again, it's working earlier with those people and their families to make sure that they get the right support before a crisis develops. Our general principle locally in Berkshire West is to make sure that mental health services and physical health services align, that they're not seen as separate, and in that way that we're not only addressing the physical problems for somebody suffering from mental ill health, but also the psychological problems that are associated with physical ill health and long-term conditions. So really we're aiming to a place where mental and physical health problems are treated together as a whole person, and making sure that services to support people are set up in that way.
The main problem with urgent care is that the demand is actually rising, and it's how we go forward to ensure that services are appropriate for people in the future and that we can provide services closer to home for them. The Royal Berkshire Hospital has recently opened an ambulatory care centre, which means that patients, when they come into hospital, can actually have their urgent investigations, have their first line of treatment, and then go home the same day, so they can continue their care in the comfort of their own home. Certainly frail patients find it very traumatic to actually have an admission to hospital. This reduces the trauma, and starting their treatment early and going home means actually their recovery is enhanced. In autumn we're launching the new Thames Valley 111 service. So in this service, when patients ring 111, they'll have access to be transferred to either a GP, a prescribing pharmacist, dental nurse or mental health practitioner, who can give them advice on their concerns, or if a patient actually needs a face-to-face appointment, then the 111 service can actually book the appointment there and then for them. The other new thing that's happening with the new service is that they're going to have interactive voice recognition. So if you do find that you've forgotten your prescription, you can ring 111 and you'll be directed straight through to a pharmacist rather than speak to a call handler. If you need a face-to-face appointment, the new 111 service has the ability to be able to book directly into the out-of-hours service Westcall, a pharmacist or one of our walk-in centres.
So I'm going to talk to you about Connected Care, which is a project we've recently introduced across Wokingham and the rest of Berkshire. So at the moment, if you were to go to A&E, the doctor or nurse you see there would have access to no information about you. They wouldn't know what medications you're on, your allergies, your previous medical problems, because they don't have access to your GP records. So what this project aims to do is actually give all the healthcare professionals you may see appropriate and secure access to the information that they need to treat you best. So we've introduced this system that gives this access, and the feedback we've had over just the 2 weeks it's been introduced has been exceptionally positive. So to give you an example, we've had a letter from a health visitor looking after a child who has been concerned that this child is attending lots of different services frequently and is worried about the safety of this child, how they're being looked after. And she said this has been invaluable in actually getting an idea of exactly where this child has been going in the health service to get a bigger picture, to be able to put a care plan in place. In the future, this system has a lot of potential applications. If, for example, you have a chronic condition and it can be seen from this system that you're attending A&E very frequently, going to your GP at increasing frequency, needing to call out the community services more, maybe there's a crisis imminent and actually you need a step up in your care. And this system allows the health service locally to be proactive in providing that step up. And then what we're looking to do is allow patients access to their own records so they can become more involved with their care and have those conversations with healthcare professionals armed with the knowledge of what's actually going on.
Patients should see a real step change in the way which services are provided for them, both in Wokingham and more widely in Berkshire West. One of the things we've really got to focus on is really reducing duplication. Far too many people have to go to hospital multiple times a year to be told different things from different specialties and clinicians. We want to really improve the way that patients get their care information just once, so they haven't got to try and queue for the car park, for example. We're working very closely with our partners in the Royal Berkshire Hospital and Berkshire Healthcare Foundation Trust on the development and deployment of our accountable care system, which essentially ensures that we'll be taking health decisions, planning for services in a much more collaborative and planned manner, rather than the previous way of working quite separately as commissioners and providers. We've defined a number of high impact opportunities which we think will really benefit our patients who live in the local area. They range from things such as a complete redesign of the way we deliver outpatient care to focusing on those very, very small number of patients who use A&E 20, 30 or 40 times a year and finding new solutions for their needs. We really want to ensure that our patients can receive a higher quality of care but much closer to where they live, so there's less requirement for them to travel further to places such as hospitals just to receive a medical opinion. We'll be trialling the use of new technology such as Skype and other video calls and the delivery of services in locations nearer to where they live so they can receive their care either in GP surgeries or even in their homes themselves. I hope you've now seen and heard a bit of a flavour of the things we've got planned for this year and the years beyond. We'd really like to hear your views, so please do get in touch and let us know.